Welcome to this Chemscape presentation on wildfire smoke exposure. During the wildfire season, early April to late October, fire is a common occurrence in many regions, producing dense smoke that can be a major source of toxic air pollutants. You may be operating in an area where the air quality is being affected by wildfire smoke. Working in poor air quality can affect your work performance and health. This presentation is intended to inform you on how wildfire smoke can affect air quality and how to adjust your work activities accordingly. In this presentation, we will discuss how to understand air quality and the Air Quality Health Index, how poor air quality can affect your health, and finally, when and how to adjust your work activities. Air quality describes the concentration of pollutants in the air we breathe. Air pollutants can become dangerous to human health if concentrations become elevated, especially for people who are sensitive to air pollution, and if you are exposed to pollutants for extended periods of time, like if you are working outdoors all day. Air quality is constantly changing, and it's affected by emission sources, weather conditions, and the physical landscape of an area. When air quality becomes compromised with wildfire smoke, it is important to monitor the Air Quality Health Index issued by Environment and Climate Change Canada on a daily basis. Because smoke can be carried by high-level winds, locations hundreds and even thousands of kilometers away downwind can be almost as severely affected as those close to the fire zone. Dense smoke from wildfires can cause very high levels of air pollution, with the amount of fine particles in the air greatly exceeding normal levels. Wildfire smoke contains fine particles that can penetrate deep into the lungs and lead to serious health effects. Some populations are at greater risk for health issues including small children, pregnant women, the elderly, individuals with lung and heart conditions, individuals involved in strenuous work outdoors, and individuals who exercise or play sports outside. It is important to note that during heavy smoke conditions, everyone is at risk. It is important to remember that everyone has a different sensitivity to air pollutants like wildfire smoke. Mild effects of smoke exposure can include symptoms such as sore and watery eyes, runny nose and sinus irritation, scratchy throat and coughing, headaches. Serious consequences of smoke exposure include breathing difficulties, including asthma attacks, chest pains, heart palpitations, and heart attacks. The Air Quality Health Index is a scale designed to help you understand what the quality of the air around you means to your health. It is a tool developed by health and environmental professionals to communicate the health risk posed by air pollution like wildfire smoke. Environment Canada and provincial health agencies monitor the air quality daily across Canada. The higher the Air Quality Health Index number, the greater the health risk and need to take precautions. Occasionally during extreme pollution events such as forest fire smoke, Air Quality Health Index levels may reach 10 or even higher, indicating a very high health risk. The Air Quality Health Index forecasts and current values will reflect the impacts that wildfire smoke may have on human health. Air Quality Health Index forecasts are issued twice a day, and current conditions are updated hourly. Check the Air Quality Health Index in your community before heading off to work, and use the forecast to plan your activities, whether over the next hour or the next day. The following table is from Environment and Climate Change Canada, and it provides the health messages for at-risk individuals and the general public for each of the Air Quality Health Index health risk categories. If the Air Quality Health Index has increased to 7, which is a high health risk, or more, It is usually because of high concentrations of smoke particles in the air. There are many activities you can take to protect yourself from wildfire smoke. On days where the air quality health index is highest, precautions should be taken to limit exposure, including limit outdoor activity and strenuous physical activities as much as possible. If you have difficulty breathing, reduce your activities or stop altogether. Stay indoors with the windows closed. Turn off the HVAC system as it may draw smoke indoors. Avoid burning items which may contribute to more air pollution. In a vehicle, keep the windows closed and set the ventilation system to recirculate. Care for others. Watch out for others who may be more vulnerable to smoke. If anyone is experiencing breathing difficulties as a result of the smoke, they can consult their physician or local health authority. Dial 811 in Alberta or British Columbia. And remember to keep hydrated, as drinking water helps your body deal with inflammation. If you need to wear a respirator for your regular work, check to ensure you have been fit tested and received medical clearance. Smoke has very fine particles, and respirators can help reduce what you breathe in. Medical clearance and fit testing is required whenever a respirator is worn in a workplace. To protect against smoke, high-efficiency respirators like P100 or N100 are needed. There are government wildfire sites listed on the screen where you can subscribe to instant updates on the wildfire situation in your area. This gives you instant updates from your nearest local wildfire information officer. It is always a good idea to review your emergency plan and procedures if wildfires are in your area. Having a full tank of gas, water, emergency supplies, and essential documentation is recommended if you may be at risk of evacuation. Review the plan for an evacuation not only at work, but also think how this will affect your personal life. Your provincial and federal government have websites with resources to help you develop a plan. Take a moment to pause this presentation and discuss who monitors and communicates advisories on air quality to workers. How can we limit our exposure to wildfire smoke? How can we adjust our work activities when the air quality health index is high? Are any of our colleagues in an elevated risk category for health effects? And what is the procedure if someone is experiencing symptoms of smoke exposure? Being aware of the effects of wildfire smoke at work and taking precautions to reduce your exposure is an important step to create a healthy and safe workplace for everyone.